And here we go. Welcome everybody to The Big Idea. I'm Dr. Jeffrey Hanna. Today we're talking about a few things that are related to multiple sclerosis. And this actually stems from a comment that was on one of the other videos that I did about things to look for on an MRI when your MRI, quote unquote, comes back as normal. Now, I will say MS is not normal by any stretch of the imagination, but this was the comment. They found white matter spots, and I see really blurry, and there's moments I feel really dizzy. Now, I'm not going to be so stupid as to diagnose, this person based on these comments here, because you go to WebMD when you've got different kinds of symptoms, problems in the body, and inevitably you're going to come up with something that's very, very scary. But nevertheless, I'm doing this video for educational purposes because even if you have these kinds of things on an MRI, one, it requires further investigation. But even if you do see that, it's not necessarily a death sentence. There's a lot of things that can be done to help out. So let's go ahead, jump into it, and have a little bit of a conversation on this very important topic. Okay, first up, this is an MRI that I have from my own archives. This is not the person. This is an individual who was diagnosed with multiple sclerosis. So I already know what's going on clinically, history, and this is what's called a Flair MRI, where the idea is that you can see all of the brain matter that should be various shades of gray, and then the fluid around the brain, the cerebrospinal fluid, should be absolutely pure black. So what I need to point out here is firstly that these black holes that we see right here, this is normal. These are what are called the ventricles. It's where the cerebrospinal fluid is up on the inside part of the brain at about this level here, up at the level behind your eyes. But what I want to point out here is where we see these white specks pretty much all throughout. So here we're seeing it multiple levels, and we are also seeing whitening of the rims around these black areas where the fluid is. Those should not be there. Now, I will emphasize a few things here. Whenever we're looking at an MRI like this, I want you to remember that doctors, specialists, we're all human. We hate giving people bad news when something is going on. So oftentimes we will be looking at films in advance, and even before we've had a consultation with the person, we're like, this is a conversation that we don't want to have. So when it comes to different things such as an MS or a neurodegenerative condition, we don't like having the conversation. But I do want to emphasize this, and this is what I'll get into a little bit later in the video, that even if some of these abnormalities are showing up, that there's a lot of stuff that can be done so that people can still live an amazing and excellent quality of life. Now, what I want to do first is make a little bit of a point of distinction here, because when we see little white spots on the brain, general rule of thumb, there's two primary things that could be going on. The first one is what's known as a transient ischemic attack, aka a TIA. What that is it's where some of the little blood vessels on the inside of the brain, they've basically gotten choked off a little bit, and as a result, parts of the brain have been starved of oxygen. When that happens, you will get the accumulation of these white little spots. This is associated with people as they do age, if they already are at risk of cardiovascular disease, because cardiovascular blood flow, it's not limited to just the heart, and it's not limited to just your limbs or your organs, it's also going to be the brain. So very, very common, people will start to have the accumulation of these different spots. So age is a risk factor, certain kinds of medications are risk factors, anything where a person is at risk of leaky blood vessels in the body, brain is no exception. Now, this person, it's not a TIA, because what we're seeing here when we're looking at the rim, as I pointed out, not just the white spots, but you can see that the white rim around the ventricles where that fluid is, that they're starting to make these little elongations that are going outward. A person can have chronic degeneration of the brain if it starts to make a rim shape around these black areas. But when we start to see that the white is starting to project outward, it's a phenomenon that's known as a Dawson finger. And that is usually pretty pathognomonic for something like a multiple sclerosis kind of problem. So we're seeing the evidence on this person's MRIs that we're not just dealing with TIAs in terms of the white spots, but that we're actually seeing a demyelinating condition going on inside of this person's body. Okay, now I want to go back to the comment where there were a few yellow and red flags that were going off in my head that was shared in this person's comment. So I see really blurry, and there's moments that I feel dizziness. The reason that that is important is the early stages of multiple sclerosis. They seem to have an affinity for a part of the brain. It's in the region, again, with that fluid flow that is in the center that's responsible for coordinating so many different eye movements. And if that is the case, a person, one of the most common initial symptoms of MS is going to be blurry vision and lack of balance for seemingly no good reason. And this is very commonly going to show up in people when they are about 20 to 40 years old, somewhere in that range. It tends to affect women a little bit more frequently than it does men. And it doesn't mean, I do want to emphasize this as well, is just because a person may notice that they're getting a slightly blurrier vision or that their balance is a little bit odd, in and of itself, that is not a diagnosis of MS. You have to have more advanced testing, such as an MRI. It could be a problem with your eyes, it could be a problem with your inner ear, it can be a problem with your cervical spine. You need additional tests. This is why I emphasize, as I said at the beginning, if you just put your symptoms into WebMD, it's going to come up as something that's really, really going to scare you. The majority of the time, it isn't. But if you start putting all the bits and pieces together and then you have a test like this, all right, this is pointing more in that direction. And if you're able to heed the early warning signs, you're able to do something a little bit more about that so that it does not need to progress to the nasty stages. I will also add, again, the blurry eyes and a bit of the double vision, is if you are noticing other weird stuff in your body, that's more pathognomonic for MS. This is going to be where you're getting weakness in different parts of your body. So this could be a hand, this can be a leg, this can be your back, this can be your neck. It's going to be where you've got multiple different symptoms that don't seem to quite add up together. This is more where we're going to need to do this in-depth investigation to see if we're dealing with MS on an MRI. But this is the second point that I want to take into this particular video. What do you do if you've been diagnosed with MS? Because there's a few things that can make all of the world of difference. I'll say first and foremost, one of the first things that you want to do is you want to touch base with a good neurologist. Certain kinds of medication, they can and do help slow the progression of the condition. See, when I was first learning about MS, when I was in chiropractic school about 20 years ago, unfortunately, MS was considered pretty much the kiss of death. It was not going to be a good diagnosis, not a good prognosis at all. Fortunately, over the course of the last couple of decades, there is a lot more that we understand about it. What it means is there's a lot more good things that we can do about it. Certain conditions, certain things, we're going to need medication. I'm not a medical doctor, but I will point you in the direction of a qualified neurologist who can give a certain kind of prescription that's really going to help to improve your overall quality of life. But there are two other super duper important things that I want to hit on right now. So let's have a look at those. The first one here is going to be circulation of the brain as it goes through your neck. There are certain types of multiple sclerosis that have been linked with whiplash injuries at some point back in the past. Whiplash does not have to necessarily be from a car accident. It's anything where the head snaps back and forth like this. That can be a sports injury. That can be learning to ride a bike. That can be any number of different things. Slipping on the ice, bungee jumping, roller coasters, heavy metal concerts, anything. If there was bad enough damage, maybe not anything broken, bleeding, or even bruising, but damage on the inside. Now, you might be wondering, what in the world does your neck have to do with your brain? Well, a little bit of everything here. because ultimately the stuff that we've illustrated here in blue, this is going to represent one of the major drainage pathways in an individual. You've got two major drainage pathways from the brain. Number one, you've got the internal jugular veins that come down the front of the neck, but then you also have what's known as the cerebrospinal venous system. So both of these are plumbing that clear debris out of the brain. Now, here's an interesting and really important thing. When you are lying down, the internal jugular veins are the primary drainage pathways. However, when you are sitting or standing up, those veins will collapse about 50%, just under normal fluid pressure. And as a consequence, the cerebrospinal system becomes the primary drainage pathway. And what I've illustrated here for you, this is it, in the blue, with all these little numbers that you see right here. So you can see that all of the fluid that's going to be inside of the brain, including the cerebrospinal fluid, is going to ultimately have to drain out through this one particular area involving the joints of your upper neck. And if the upper neck is not sitting, moving, stable the way it's supposed to, this can represent a literal choke point for that normal circulation coming down. Now, something that's different about veins inside of the brain versus veins pretty much anywhere else in your body. Veins everywhere in your body, they have valves that prevent backflow. The ones in your brain don't. So if you've got something that's creating a little bit of constriction, causing fluid to flow back up into the brain, what it's going to do is it's going to stay stagnant inside of the system. So instead of it being able to circulate freely here, it can start to accumulate back into these areas that I'll illustrate right here. So this kind of little gray zone right here, this is around your cerebellum. Cerebellum is involved with motor coordination. It's involved with brain clarity. It's kind of the conductor for all processes that go on side of the brain. It's also going to be intimately involved with balance, amongst other things. But it can also accumulate into this area right here. So this area, it's known as the tegmentum. And you might notice I've drawn these light little gray things right there. Those are what are known as the colliculi. This is the area that MS has the tendency to start. And this is the area that is responsible for coordinating so much of that movement between your eyes, between your inner ear, and ultimately to other parts of your body. And this, we believe, is one of the reasons why one of the earliest signs of MS is that a person's going to be getting blurry vision for seemingly no good reason. They have their eyes checked. Nope, it's not coming from your eyes, but something is not working right. So there is research out there that's showing that if you can address some of these issues that are going on, again, with the motion, the alignment, the stability in the joints of the upper neck, it assists with circulation inside of the brain. It doesn't mean that it's going to fix, it doesn't mean it always cures everything, but this is one important piece of the puzzle that can help people out who are experiencing multiple sclerosis. The profession here, this is what my specialty is. This is what's known as an upper cervical chiropractor. This is not somebody who's going to be bending, twisting, popping, cracking the neck, but doing a series of very precise corrections that are guided by imaging, determine what's the exact location, direction, degree. How do you correct that area so that you can restore that normal function as much as possible? So the first thing is working with your neurologist and figuring out is medication appropriate for you to help. Number two is going to be the function of your neck. This is where an upper cervical chiropractic specialist can help. But there is a third one. This one is outside of my area of expertise, but I refer out for this one because this one is super duper important. This one here is leaky gut. Okay, let's look at this. I did a whole video on this one. It was probably a few months, maybe even a year ago at this point, and I argue that this is probably one of the most important videos that I've ever done for people who are experiencing any type of autoimmune condition. Autoimmunity is where your body's immune cells start to attack your own cells as if it was a foreign invader. And depending on what type of cell is being attacked, whether it's brain tissue, whether it's heart tissue, joint tissue, muscle tissue, thyroid, adrenal, that's where we're going to start to experience the different kinds of issues here. So I'm going to recap a couple of bits here as it relates to MS, because one of the major contributing factors of MS is the nature of an autoimmune condition. Again, there's the physical component, and then there's also the chemical component. We're going to relate this to leaky gut. Firstly, what is leaky gut? So leaky gut is where the normal tight lining of your digestive system starts to get leaky like this. As a consequence, things start getting into your bloodstream through an abnormal route. When that happens, your immune system says, wait a minute, this isn't supposed to be getting in this way. This must be a foreign invader. And then it starts to learn different kinds of things that are going to be associated with that. And then that's going to start to produce an immune response against different tissues in the body. In other words, the immune system is deceived into thinking that self is a foreign invader, and that sets us up for issues like that. Now, the question is, what produces leaky gut in the first place? The number one biggest factor, again, it's when anything gets into your bloodstream that shouldn't be getting in that way. Diet. Anything that is inflammatory in your body is not going to be good for you. So this can be processed foods, this can be additives, this can be chemicals, this can be certain substances that are injected into you, because not just the gut, but also the lining around your brain like this. It's supposed to be super duper tight. When you start to have inflammation in your body, then that barrier starts to become leaky, and things can start getting into the brain that should not be there either, and that's what starts to produce inflammation in the brain, which seems to be the process that's ultimately going to contribute toward multiple sclerosis. So what these particular guys, again, this was an absolutely brilliant study, but I want to show you this slide right here. What they found was that when you've got a leaky gut, this contributes to every single type of autoimmune condition that we know about, some more than others. And the four biggest ones are the ones that I've highlighted in the pink right here. So the odds ratio, in other words, this increases your risk factor of developing these kinds of conditions by X number of times. So we'll start here. We'll just read top down. So the bigger the number, the more significant the risk factor. A 21 hydroxylase. This is one that's going to be targeting your adrenal glands. 28 times greater with leaky gut. So inflammation into the body targets the adrenals. Arthritic peptide. This is going to be increasing it 30 times. This has an affinity for your joints. Constant pain in all different parts of your body. Commonly what we might identify as a fibromyalgia. Cytochrome P450, this is your liver. Liver is essential for detox. So you can appreciate if you've got an autoimmune issue that's targeting your detox organ, then the thing that's supposed to get the bad stuff that's in your body, that's not able to work. So it's going to be a revolving door, a cascading cycle, not good. But here's the one as it relates to MS. Cerebellar IgG, 22 times. That is brain tissue. So when a person's got leaky gut, there's a 22 times greater risk of developing some kind of neurodegenerative process. What this means is that, again, maybe not the sole cure, not the sole causative factor, but for a person, if you want to either prevent, protect, but also work to try to resolve, improve what's going on with an MS or a neurodegenerative condition, diet and healing the leaky gut is a huge piece of this. Who is expert in this space? This is going to be functional medicine doctor. This is going to be a nutritionist. This is going to be a naturopathic physician. I trust these experts in terms of what they know. This is, again, not my area of expertise, but I do know if a person wants to get the very best kind of results, you have to look at diet, because MS, and I have seen MRIs of this, MS lesions can be, maybe not always, but they can be reversible. It is not a one-way street. So if you're able to do whatever medication is necessary to help manage the symptoms, if you're able to clean up things in your diet, detox as good as you can, restore your body's function, decrease the inflammation, and resolve any of those mechanical issues in the neck so that the system can flow, so that the plumbing can cleanse the brain as good as it possibly can. These things can significantly increase the probability of getting a good resolution so that MS does not have to absolutely ruin your quality of life. So there we go, bit of a deep dive, but how just even a couple of basic symptoms, again, they can set off a couple of little red flags for us. But even if that's the case, again, this is not meant as a video to diagnose anybody with any condition, but there's a few yellow red flags there that require the investigation. If you're dealing with white spots on the brain, then you've got to determine, is this an MS condition? But then even if that is the diagnosis, there are a lot of things that can be done so that you can still have a very, very good quality of life. So I do hope that you guys found this video informative, educational, also not too terribly boring. And if you have enjoyed it, please do always remember, click that like and subscribe button, share this video with friends, family who you think would benefit from watching this. And if there's anything that we can ever do to help out, feel free to reach out to us. So we're here at Clear Chiropractic in Spokane, Washington, where again, we're focusing on health, alignment, function of joints in the upper neck. You can check out any of my other videos here on YouTube. You can go over to our website, which is clearchirospokane.com, where we have a series of blog articles, other videos, content, because ultimately our mission is helping people live the very best quality of life that we can. And anything that we can ever do to help out, we will do our best. Thank you guys again for watching. This is Dr. Jeffrey Hanna at Clear Chiropractic. Get well, live well, stay well. Next time, take care. Bye-bye.